Well, it's kind of a big name, peripheral neuropathy, but boy, if you're suffering with it, you know exactly what it means, and maybe you've got some of the symptoms and you haven't put a name to it yet. Well, let's do that this morning and then get you some help. Dr. Nicholas LaHood is here this morning, and we're going to talk about your neuropathy program. Explain what neuropathy is for folks first.
So, Mark, it's a big word, but it just means nerve damage to the small nerves in your feet or toes. The most common symptoms are numbness and tingling. It feels like your feet are constantly asleep, or a burning sensation when you're trying to go to sleep at night.
Now, this is very commonly associated with diabetes. Is that mostly what you deal with?
Yeah, but I mean, also people can get this peripheral neuropathy from going through bouts of chemotherapy, or if they have some vitamin deficiency. So, but you're absolutely right. Diabetes is one of the #1 causes of it.
So if you've got this nerve damage to your feet, and again, I want folks to notice the number on the screen right now, and understand what you're offering for the first 25 callers here. You're offering not only a free exam, but 2 free treatments in a rather innovative way that you have learned to treat peripheral neuropathy that's getting great results.
Yeah, I mean, it's amazing. You know, the most common treatments right now are just medications to get rid of the burning pain, to get rid of the sharp pains that the patient feels at night. So we've got a great solution it's a non-drug approach.
So what you're doing here is testing somebody, and this is the exam that you'll probably give folks when they come in, correct?
Yeah, so we look to see how much nerve damage there is, and we measure it using the gold standard of testing, the Toronto scoring system. So we know exactly where the patient's starting out. We take the patient through 2 free treatments, and we can measure their progress. So, you know, the treatment consists of stimulating the nerve to get the nerve to function much better.
So there's a foot bath that we're not going to look at right now, but just suffice to say that it's a foot bath that stimulates the nerves, and then this laser. And this laser, we're finding in your office that this has so many applications, but it's really showing results for non-surgical treatment, non-medication treatment of neuropathy.
It's amazing. I mean, you hit the nail on the head. What we want to do is stimulate that nerve and get the nerve to function better. We just don't want to cover up the pain and let the disease progress for years for the patient.
Right.
Let's get to the cause of it. Let's stimulate the nerve. Let's bring in more oxygen to the tissue. You know, Dr. Costello from the University of Toledo did a lot of research with the Class 4 laser, and it shows that it brings better blood flow to the area. And this helps with the nerve tissue because it needs oxygen to function. So
you're actually getting nerves that were non-functional. You're getting them to regenerate and function again normally?
You know, we do such a great job on reducing the patient's symptoms and improving the nerve function overall. It's sort of, you know, you can think of it as a pacemaker for the nerve. Just like a pacemaker for the heart creates a rhythm for the heart to function stronger, we use this stimulation and we use our laser therapy to get the nerves to function much stronger.
So folks, if you have any of these symptoms that you're looking at here, and again, as we've talked about so many times, one of the key injuries, especially in older folks, is falling. And if your feet are numb and you can't feel the floor properly, that is really putting you at risk.
You know, that's a great point. One of the big problems with neuropathy, besides ulcerations, is balance difficulty. And the patient can't feel the ground, and so it brings this instability. That's very dangerous. So I definitely encourage you, if you have any of those symptoms, numbness, burning, balance difficulties, give our office a call, because this is a safe alternative to using medications.
And folks, again, no obligation whatsoever and absolutely no cost to you. So whether it's you or a loved one, you're welcome to call and make the appointment on behalf of somebody that you know. We just ask that you keep the appointment, because the office is absolutely trying to maximize everybody's opportunity to get in for these free treatments. So just if you call, make an appointment, I just ask that you please keep the appointment. First 25 callers, absolutely free, 2 free neuropathy treatments with the foot bath that I talked about, which they'll explain to you, the lasers. You get to talk to the doctor, get a full examination and a consultation, and again, at no risk to you, no obligation whatsoever. So I don't see how you can go wrong with that.
Yeah, you know, patients report that they sleep much better because of the pain reduction after the first visit. So it's just a great solution to peripheral neuropathy.
Folks, give it a shot. Go see Dr. LaHood right down there on Mission Center Road. All the information's on our website. It's san-diego6.com, and you click on San Diego Living for more info, but we'll hook you up. If the phone lines are busy, please just keep calling, and they'll get you in there.